So I should have made a full recovery, and I didn't. And we think, from talking to the medical professionals, that it was because I didn't have timely surgery. So my name is Cedrone, and I'm from Hamilton, Ontario. So my back pain started, it was late March of 2022. I was out clearing snow, and I slept and fell on some ice, and had a little bit of back pain. And it got progressively worse as time went on. And then towards the beginning of April, I think it was the first week of April, I ended up in an ambulance to the hospital because the pain had gotten so bad. And I couldn't get comfortable in bed that night. So initially, after I had the back pain, I went to my doctor, because I said to him, I said, listen, I slipped and fell and I has this pain in my back and it's not going away. And, I did the Advil Tylenol thing and it's not really helping. So he put me on something a little stronger for the pain. And he says, I think we should order an MRI and have a look at what's going on. So he booked the MRI and I got the thing in the mail and it said 4 to 6 weeks. And mind you, I was off work at this point, couldn't work because the pain was too awful for me to do as a bus driver, bouncing up and down in the seat. I work for the city. So I said, okay, no problem. So as the pain got worse, I thought, you know what? I think I'm at the point now where I would just like to find out what's going on in my back. So I laid flat in a minivan and had my mom drive me to Buffalo. We crossed the border. Customs obviously had a lot of questions as to why I was on a mattress in the back of a van laying flat and not sitting in a seat. And got across, in and out, had my MRI. It was fantastic. They were really great with me. Took it home on a disc that day. And thank God I did, because not 2 days later, I would find myself in an ambulance on the way to the hospital, and they needed that MRI because I was in so much pain, I couldn't have an MRI at the hospital that night. I arrived at the hospital, waited in the ambulance for quite a while. I think I was about an hour, and then I get into the hallway, and at this point, the pain is so bad, and I'm starting to go into shock. I'm cold and I'm shaking. And I laid in the hallway for a couple of hours before I even got put in the ER area for like an ER attending doctor to see me. And it was at that point that we realized that I started to lose feeling below the waist and my spinal cord was involved. So he immediately did the test to see, and I had lost feeling all below the waist. When I went down below the waist, they knew the spinal cord was involved. They still weren't able to put me in their MRI machine. So they used the MRI I had done at Buffalo MRI that we had on the disc we provided to them. And they said that they would have a spinal surgeon come see me. And we found out later that there wasn't an orthopedic surgeon within 100 kilometers that could see me until the next day. So I should have made a full recovery, and I didn't. And we think, from talking to the medical professionals, that it was because I didn't have timely surgery. And then because of that, it led to complications. And then I ended up having to have another surgery 9 days later. And I probably had compression on the cord at some point in those 9 days, again, for multiple days. And it's that pretty well sealed my fate, that now I'm stuck with this traumatic injury to my spinal cord, lasting, neuropathic pain and physical disability. I had talked to my husband about it and said, listen, I've always been a firm believer and always been a fighter, but this neuropathy, until I dealt with it myself, I was like, wow, I had no idea the body could do this to itself, just totally make you question everything and just take every ounce of strength out of it. Even just talking about it now, it just brings tears to my eyes, and I said to him, I remember waking up the one morning, it was 12 hours, I was in pain, and I said, I just can't do this anymore. I just want to swallow my bottle of pills and be done. And that's awful to think that, your only out's going to be death. You should never come to that, And that's why now I fight so hard. I try to share my story or, work with the pain clinic because I don't want that to be the option. I don't. Probably before all this had happened, I was probably a very staunch advocate of public system, couldn't change my mind, leave it the way it is, and yeah, it's not perfect, but it works. Now that I've been through it and seen it firsthand, I'm very much for you know what, there are better options out there. And, you know, looking into other medical systems around the world, I had heard about, you know, certain Nordic places in Europe where they've set time limits now for service. And if the public system can't offer it, you can go to a private system and the country will pay for it. And I think we need something like that in Canada, both, you know, to sort of kick the public system in the behind to get them producing better. Because I've also found out that, you know, we spend the most out of all OECD countries, yet we have the worst outcomes. So it's not a money problem, it's a productivity problem, and it's a resources problem. And I think that, you know, maybe a mix of private, public, but with proper regulation so it doesn't get away from us. Here we could put people first, but maybe private could deliver it better. And we're already doing it with life labs, you know, a blood lab. And we're already doing it with people that have cataract surgeries and so on. And it functions. So why can't we have more of that where it works for people and we don't have long wait lists and we don't have people like me ending up, you know, not able to contribute to the system any longer and living their whole life in chronic pain, you know? And it doesn't need to be like this. So probably the hardest part about this whole thing is not learning to deal with my new body and my new way of life. It's the fact that, you know, I was a contributing member of society. I could walk. I drove a bus for the city. And, you know, I loved everything about my job. I loved interacting with the public. And now I'm left with living in chronic pain. I'm bedridden most of the time. You know, I can leave my bed, but the pain usually has me up most nights. And I can't do much else other than exist. And it's really difficult to go from one to the other. And, you know, like it's not even the physical disability. It's the fact that the pain limits me so much that I can't do anything. And it's awful. It's really awful to deal with that kind of life change. Nobody should have to choose between life and death because, you know, the system wasn't there for them. Like, that's not acceptable. So that's why I do what I do, and I am who I am, I guess.
To learn more about healthcare reform, please visit secondstreet.org and don't forget to hit that subscribe button.